So now let's talk something very, very special, right? सभी के दिमाग में ये आ रहा है, सब कुछ पढ़ लिए, सीख लिए. अब अगर हमें टोबैको सेशन सेंटर बनाना है, लाइक आई वाज टॉकिंग टू सुदीप वांट्स टू सेट अप अ सेंटर, तो उसका कैसे होना चाहिए? व्हाट शुड बी देयर इन द सेंटर, है ना? What are the things that is required? What is the way? So let us just talk a little bit on these centers. Okay. See, this is the current scenario. You know, there are 26 crore people taking tobacco, and you're finding people taking tobacco everywhere, all around, है ना? हर जगह जगह मिल रहे हैं. And if you are a clinician, adult clinician, मतलब you're dealing with adult patients, not a pediatrician, you will get almost 60% or 70% of the patients you will come to you are having some tobacco use. Am I right? But tobacco users will visit hospital more than the non-tobacco users. Okay? So there is the current scenario. They need help. I want to quit, but there is a need a tobacco cessation specialist, and that is what is required. We need to have more and more numbers of tobacco cessation specialists everywhere. Okay? A world where a trained tobacco cessation specialist is available to every patient. Like Madam has said, why means till now, if a person, what is happening, the biggest problem right now is the lack of tobacco cessation specialist, and the bigger lack is the lack of knowledge by the treating or a clinician in the, he may be a neurosurgeon, he may be an oncosurgeon, he may be a neurologist, cardiologist. They have lack of knowledge about tobaccos, how to help a person to quit tobacco. So what they do is, but they also have a ego problem because they cannot tell that, yes, look, I have a lack of knowledge, so I need to have more knowledge. But they would go ahead and treat the patient as if they know them, they have the knowledge. This is the biggest problem that we are facing right now. A person who visits a neurosurgeon will not, if the person asks neurosurgeon, if the patient asks to the neurosurgeon, ki mere ko tobacco chhodna, because the patient had a stroke, now he wants to quit tobacco. The neurosurgeon will never think of referring the patient, but he will give him a guideline, whatever he thinks is right, even if he is lacking the knowledge. And this is the biggest problem in India, right? But with the presence of tobacco cessation specialists at every place, everywhere, and if a person is getting good response, good treatment, then definitely the confidence level of the referring doctor, the confidence level of the patient, and more importantly, the confidence level of the treating doctor, the treating cessation specialist will improve. So this is one of the, just a glimpse of the center that we are having at Max. And here what we have, we are doing a complete setup. This is the complete setup there. We are doing oral screening, oral prophylaxis, oral rehabilitation, tobacco cessation, community networking or community programs, and diagnosis and treatment of PML. You know, so this complete things we are providing. So here what is there? Successful tobacco cessation means increase patient confidence, increase patient compliance, because and increase patient experience. A proper center, you know, the patient who comes in, he should have the confidence that this particular person who is to whom I am going will be able to help me. How will he get that confidence? How will that patient get a confidence? Well, if I go to Nikita, Nikita will be able to help me. Nikita, kaise degi? How do you give that confidence to your doctor, the network doctor?
So can you just please repeat the question?
I am, see, increase patient confidence. How, if a patient says, if a patient is referred to you, how does he get a confidence that Dr. Nikita will be able to help him to quit tobacco?
Yes, sir. So at first, the patient will have a confidence in communication. Only a specialist can provide to him. Active listening, sir, looking at his history, giving a very nice answer, going through all of this, sir.
वो तो सब बाद में आएगा ना, पहले कैसे कॉन्फिडेंस मिलेगा जब मैं इस ये दुकान सामने में खुल रहा हुआ है, आई एंटर इनटू दैट शॉप और आई शुड नॉट एंटर इनटू दैट शॉप.
We have to put up the tobacco cessation and the harmful effects, so many posters, so that he immediately come and see and make out that this is the place where I can get the help.
Yes, wonderful. So basically the visibility has to be there, the visibility of the center, that yes, with a nice board there, yes, this is a tobacco cessation center, there is a doctor whose name is there, and there is you can write that he's a CTCS or she's a CTCS, certified tobacco cessation specialist. When you put that visibility is there, the patient will have the confidence to look at the center and get into the center. Then when he enters the center, how does he get the confidence? The environment, the ambience, the environment, whether it resemble, does it look like, yes, this is the tobacco cessation center. He may like to see your certificate, which has been put there on the wall, right? So keeping that, once the patient gets the confidence, then only he will start talking to you, or he will go and pay your fees and then come to you, right? So the visibility, so the first is the confidence. Once he has the confidence, that is likely to increase in the compliance. He will come back. Once then comes your active listening, talking, intervention, and all this thing. Then comes the intervention. Once he feels that yes, he has got the right thing that he wanted, then the compliance will come. Then he will like to come back again to you if he's feeling confident with you, if he's feeling comfortable with you, right? Am I right? So the center environment plays a crucial role in for delivering the right messages to engage and motivate a tobacco user to quit tobacco. Okay? So these centers have to be there, visibly there, right? So this is very important. Capability, that is the skill of the doctor, has to be really shown that yes, this is the doctor, right? Then the availability, yes, the tobacco, as I said, tobacco cessation specialists should be available everywhere, in the hospitals, at all the places, so that the patients can be referred to these places, right? Skill, that is the available capability, is the skill of the person, right? Now that you will be a CTCS, you will be skilled, you have the capability to treat a patient, right? A cardiologist who doesn't have a CTCS is not capable of treating that patient, right? But you are ready to treat a patient. Okay, na? Then comes the availability. You are available at the place where the patient is requiring. So we are now trying to make it available directly by offline methodology, by setting up centers, and by online methodology, by virtual clinics, right? And the third is the visibility. That is, the center should be visible, right? It should not be in one of the corner. It should be in a visible place. If you are putting it in a hospital, it should be visible. If you are putting, like Sudeep is going to put it in his clinic, then it should be in the right at the entrance. You know, people should be able to know that yes, there is such a center available, right? And then the fourth is the networking. Networking with what? Networking with fellow doctors, right? Number one, networking with the social workers in your community. Okay? So the fellow doctors who will be referring the patients to you, because now they know that yes, you are capable of handling such patients. You have been skilled to handle these patients. What is important is here is you need to give a regular feedback to your doctor. Okay? So that the patients, right? So when you give the regular feedback to their doctor who has referred the patient to you, the patient will get more confident with you. He will be ready to send more patients to you. Okay? You give him a feedback, you thank him, you say that yes, this is what I have done with the patient and this is how it is working. And if the patient has been sent to you by a cardiologist and he's on antihypertensive drugs, you can even tell to the doctor, since he will be quitting tobacco, please, we will request you to have a close monitoring for his blood pressures so that he doesn't go into hypotension, right? So a feedback is definitely something regular. So a network with a regular feedback from the social, that is social workers, that is tobacco marshals in the society, creating tobacco marshals in the society, and the doctors who will be your allied partners. Okay. So what are the important aspects of TOC? So these are the 7 important things that we need to work for the TOC, that is the Tobacco Cessation Center and Oral Care Centers, the environment, the person who should be there, senior specialist and a dentist with CTCS, educational and motivational resources should be available, the pharmacy should be there, the digitalization, that is what we are doing, the billing facility should be readily available, and the revenue model, which will actually make sure that you are running a profitable business. Okay? All the 7? Any questions till now, or should we go ahead? Okay, so now comes to the environment. Just look at this environment. We have kept this. This is the Muradabad Center. We have kept where the tobacco wellness. It is so well, nicely put it there. There is the certificate available. We have put some standees and all. So everything is there so that the patients get attracted, and the doctors also know that yes, such a place is available. This is in one of the hospitals, right? So hoardings prominently declaring it as the tobacco station and oral care centers. Patient waiting area. That means if you are a multi-specialty hospital where there is a patient waiting area, or even in your clinics, wherever the patients are coming, there should be posters and LCD display about the harms of tobacco and benefits of quitting. Then you also is the display of your certificates, which can be there, and maybe some patients about the patients. I'll be showing you that. So flyers, brochures as takeaway for the patients should be available. Assessment forms or the app, certain self-assessment parameters, height, weight, breath, holding time, symptoms list, willpower index assessment, tobacco addiction, etc. They can download the app and they can just fill it up themselves. Posters should be available. I'll be showing you some posters. Behavioral therapy, 8D intervention, health benefits, etc. Handouts like Be Smart, Do Not Start book should be available. Self-oral examination books, second-hand and third-hand harms of smoking, chewing, that should be available. Brochures like tobacco marshals, creating tobacco marshals, group therapy, alternatives to tobacco use, like whatever the alternative, those brochures should be available. Bulletin board, like recent news articles, upcoming programs, like if you are planning some programs or if you have done some programs, so or the news articles, review articles, recent news articles, that can be put on the bulletin board, which is there. LCD display, videos of the champions, methodologies, etc. Like I'll just show you that some of the certificate, and of course the most important, the certificate should be prominently displayed. Your certificate that you are a certified tobacco cessation specialist, which you'll be getting, should be prominently displayed. So this is something like this. This is one of our Supriya Wadhwa. We can Shruti can share the simple format of this so that you can put your picture and you can display it there. Right, you can make your own picture, you can make your own poster, and you can display in your clinic. Shruti, we have the this thing, na? This format.
Yeah, we have. I'll share
So we can supply that so that you can make that. Yeah, that would be great, right? So prominently displaying the certificate assures the client and gives the confidence generation. Okay. So these are the certificates like tobacco marshal certificate, orientation course, certified tobacco cessation specialist. And these are the prominent boards that we have designed, which looks alike, and it gives a recall value, very fast recall value. Acha, acha, this is the ICanCaRe tobacco cessation. The moment you see a particular type of a logo or particular, it gives a recall value. So we have designed a board which you can take. So you can change your name, you can put your name here, and you can. So these are the different types of boards that we have made. Tobacco cessation specialist, tobacco wellness centers. So this actually helps a lot. So this is a winner story that we can you can have your own winner story. This is one winner story that we have, right?
जी, मृदुल जी से मैं मुलाकात हुई थी 3 साल पहले एक हमारे कैंप में, जब हमने ICanCaRe का कैंप लगाया था। और इनका मुंह पूरा लाल, तंबाकू से भरा हुआ, और वो बिल्कुल तैयार ही नहीं थे कि वो तंबाकू छूट सकता है कभी। मैंने उनको समझाया, मैं डॉक्टर पवन गुप्ता, कैंसर सर्जन, और एक हम लोग एक संस्था चलाते हैं ICanCaRe, जिसमें हम लोग सेव द यूथ कैंपेन करते हैं। उसी के निर्धारित हमने ये कैंप किया था। मैंने उनको प्रॉपर्ली समझाया कैसे छूट सकता है।
मैं मृदुल तिलकधारी आपसे अपने एक अनुभव साझा करना चाहता हूँ। मैं एक एक दिन में पूरा एक एक डब्बा रजनीगंधा का खा लिया करता था। मैं उससे परेशान भी था। एक दिन मैं डॉक्टर साहब से मिला और उन्होंने मुझे अपने अनुभव से मसाला छोड़ने को कहा और ICanCaRe से जुड़ा। उनके रूल फॉलो करने से आज मैं इतना संतुष्ट हूँ कि पूरे 3 साल हो चुके हैं और मैंने मसाला अब नहीं छुआ। मैं पहले से बहुत अच्छा महसूस कर रहा हूँ। अब मुझे खाने में भी स्वाद आता है और मेरी हेल्थ भी पहले से बहुत सही हो गई है। तो इसलिए मैं ये चाहता हूँ कि अगर किसी मेरे भाई को ये मसाला छोड़ना हो तो प्लीज़ 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 ICanCaRe से वो संपर्क करें, उसके रूल फॉलो करें।
इसमें हमारा एक ही चीज़ है, अगर हम लोग सही तरीका अपनाएं, जो तंबाकू छोड़ने का सही तरीका अपनाएं, जिस तो ये छूट सकता है। तंबाकू एक बीमारी है, और बीमारी को छोड़ने के लिए उसके लिए दवा की भी ज़रूरत है, उसके लिए हमारे थेरेपी की भी ज़रूरत है। तो हम लोग ICanCaRe में जो हम लोग करते हैं उसको हम लोग बोलते हैं ABCD ऑफ टोबैको सीजेशन। दैट इज A फॉर एक्टिव मोटिवेशन एंड कमिटमेंट, B फॉर बिहेवियरल थेरेपी, C फॉर कोमॉर्बिडिटी मैनेजमेंट, एंड D फॉर ड्रग्स एंड मेडिसिन। इसमें अगर हम लोग देखेंगे, जितने भी तंबाकू लेते हैं उनके मुंह में काफ़ी कुछ बदलाव आ जाता है, तो उसका भी ध्यान रखना बहुत ज़रूरी है कि वो आगे चल करके कैंसर ना बन जाए। तो हमारे ICanCaRe में हमारे 3 चीज़ का मैं यहाँ पर आपको ज़रूर कहूँगा। बी स्मार्ट, डू नॉट स्टार्ट, दैट इज जागरूक रहें, प्रारंभ ना करें। विन ओवर टोबैको इज ईजी, तंबाकू को आसानी से छोड़ा जा सकता है। और तीसरा, बी केयरफुल एंड फेयरफुल, जो तंबाकू ले रहे हैं उनसे आप थोड़ा सा दूरी रहें, उनसे आप सचेत रहें। ICanCaRe से जुड़ने के लिए आपका नंबर है 011-430-77695। जिनको भी तंबाकू छोड़ना है प्लीज़ कॉल करें। हमारे जो स्पेशलिस्ट हैं, सर्टिफाइड टोबैको सेशन स्पेशलिस्ट, आपके संपर्क में आएंगे और आपको साइंटिफिक वे से आपको तंबाकू छुड़वाएंगे। धन्यवाद।
ठीक लगा? So this is certain, when such things are displayed, such things are available, patients feel confident and they will be there to be participate in your program. So आगे चल करके, what are the other things that is required in your center? Examination room, it can be there should be basic equipments like blood pressure, height, weight, pulse rate, SpO2. Examination couch, generally we have used a dental chair with associated equipments for oral cavity examination, screening. Breath holding time, peak flow meter can be there. CO monitor for breath CO estimation. It although we have because during the COVID period we stopped it, but now we are going to reintroduce it. The furnitures, how the alignment of the furniture should be such that the patient it is in a friendly way, but at the same time safety of the doctor is important. The COVID time we had a lot of, it was important that we play safe, and there should be enough of chairs for the patient and relatives for the family intervention. That should be important. The staff में क्या क्या चीज चाहिए? एक तो nursing, reception and back office, regular training processes like courses to approach patient with empathy, individualized and non-judgmental, communication and negotiation, implement standard intervention process as per the ICanCaRe tobacco cessation protocol. Dental specialist with certified tobacco cessation specialist certification will help in both ways, oral care as well as dental care, as well as oral as well as tobacco cessation. Network for referral to higher or specialist for comorbidity management. It should be a networking system, both get referral as well as to send patients to them, right? So that is important. And another very important, the payment should be easy, whatever they want, for the consultation, for the medication that they will purchase or whatever it is, it should be an easy way that so that they do not have the trouble. So this is the center, and these are the posters that we have made, and this can be made available for you. This sample posters. right? And you can put your own stamp, your clinic, whatever it is, you can use it. So these are the alliance partners, the 7Ds, and the different types of other posters that can also be used in your center. Let's run networking, benefits of quitting smoking causes CVD. Well, so many things are available which can be easily used for the patients, and these are all ready-made. Just you have to order for that, or we can send you the this poster design. You can get it printed if you want to print it in the quantity. So these are the books, and I believe these are in multiple languages. And these books like Be Smart, Do Not Start is a must at your clinic. And the other book that can be given to your patients, this is a Win Over Tobacco Made Easy, and I don't give it free of cost. I'd ask them to purchase this book. These are the other books that is mainly for your understanding. Of course, you have received this book, and so these are how to tobacco sell, wellness centers, and other things. So these are the other things that can be given. And this is the sessions, the amount that we are charging to our patients. So we have given them exactly described what type of intervention, what type of what we will be doing, and how much they need to pay, right? So this actually is very the patients get a clarity once the patient once the patient has the first consultation. Then we ask them to take a package according to the requirement. The patient may take a package, may not take a package. That is their own wish. Okay, na? If they want to come back again and again, so they have to pay each time. They have to pay. If they have taken the package, they have got they can assess us, or they can talk to us. They can talk to us on the WhatsApp as many times as possible. Okay? Does it make sense? So
Yes.
you have talked about the environment. So just look at the location and model with specialists. So these are different models, like Dr. Rajkumari said. So this is for the multi-specialty institution or specialty clinic-based centers. This is the model where we have the director, we have the intervention specialist. So a complete setup is there, which is specifically for in the multi-specialty centers. Then we have got a dental hospital-based centers, like specifically almost all the dental hospitals, they need to have a tobacco cessation centers. So again, this we have got the model there. And then it's the standalone model, like what Dr. Rajkumari is saying, that if we don't want to have such a huge center, that Dr. Rajkumari is a ENT surgeon, she already has a ENT setup, right? Oral cavity examination is already there. So what she needs, just a simple our app that needs to be there, a few instruments that need to be added to her center, like CO monitoring or peak flow meter, and so certain very few instruments that needs to be added, and her center is ready to start. But she has to increase her visibility and she can start working herself. So this is again as an individual, as a standalone, as your own clinic, or you can also set up a centers in one of the multi-specialty hospitals or somewhere where you can get a proper system set there. So these are the different models. So educational and motivational resources that needs to be kept in the center, I have already shown, right? So various things like books, badges, mugs, champion trophy. Tris care is a must in your a cappella, lung exerciser, similar. So these are some of the things that needs to be kept and should be at the eye level and available for purchase, right? And then these are the e-pharmacy, like what Dr. Rajkumari is saying. I'm just going one by one to that. So before the next slide, again, I will ask what she wants and I'll show that, right? So e-pharmacy, like the medications for tobacco cessation and comorbidity management supplements should be easily available. So one is the in-house pharmacy, that you can have your own pharmacy in your clinic. You can just order certain things, certain medications, certain few things, and you can keep it there with you. Local pharmacy, that you think that no, I don't have an in-house pharmacy. You can have your local pharmacy, that is the pharmacy which is outside your clinic, or the hospital-based pharmacy, right? You can ask them to keep such medications with them. Third is the ICanCaRe pharmacy. We are available. It is a centralized dispatch system. The patient can order it on our site, and we will send the material to their house. Okay? So readily availability of medication ensures compliance with patients. If the patient has to go out and search for the medications, the patient will lose interest. He will not go for that. So it should be easily available. Either you have in-house pharmacy, local pharmacy, or ICanCaRe pharmacy. You have the choice, right? So at the ICanCaRe pharmacy, we are giving it at a subsidized cost to our partners, right? All of you, I have shared the cost, and we will be giving you at a very special price. We have been able to negotiate with the companies, and we keep only 10% out of it, and we give it everything to you, right? So directly you can get all your materials, all the medication, everything that you need through our ICanCaRe pharmacy, right? If the patient wants it, yes, they can have it. Their medication at doorstep for better compliance. They can be supplied directly to their house. Okay, so the pharmacy there now, what is the requirement? So electronic record keeping on ICanCaRe app, tablet, Android device, printer, and laptop. These are the requirements that you need to have in your center. One tablet or either of the Android device, a printer, and a laptop. That would be required. Continued motivation and follow-up group on WhatsApp for active motivation. So we have got a WhatsApp group where we keep on talking to the patients. We do a discussion. The laptop will help you in doing a online counseling, online consultation, and at the same time, the quit coaches and the quit coaches and the quit buddies are also in connect with the patients. Online yoga sessions like group therapy can be also done according to the your place. If you want to do a offline group therapy, maybe a weekly therapy or bi-weekly therapy or a monthly therapy, that way the patients also get motivated. Virtual clinic, we are multilinguistic follow-up online clinics on virtual clinics we are doing, and we would look forward that all of you join the virtual clinic that we are already in place, so that if the patients come in, you can also become a part of the treatment program. The hybrid clinic is there, physical visits and also integrated virtual telephonic follow-ups, because the patient may visit for the first time, then the rest of the thing that can be done online. That is another way of doing things. And of course, the quit line model. The quit line number, we have made a central number. You can have your own number. The patients who come to your clinic, you can showcase them that this is the number. Please, you can, whenever you have a problem, you can ask your patients to give this number to their colleagues or other people who need tobacco cessation, and you can advertise your number also, quit line number. Otherwise, you can use this number as a quit line number. And if you are our partner in your tobacco cessation, we forward these patients, if they belong to your to your city, we forward these patients to you, so who can have a regular follow-up. So the billing facility, institution to have patient billing system. If it is the institution, if it is a individual, you should have some billing facilities or billing system that can be available. One thing that I have specifically not put here, but I want to say, a lot of these patients who are on panel, those who have got a insurance, they don't want their tobacco cessation to be documented in their clinical program, in the clinical prescription. So we give them as a separate tobacco cessation program and a separate prescription, separate billing, separate this thing, so that these patients do not get it. The insurance continues, right? So these are the various systems that we can put. So there are center types. There, the powered center, the brand center, the franchise center, or the allied partner. These are the 4 types that we are working on. Like powered center, you can set up your center, and ICanCaRe app is there, which we are giving it to you. And so this app is on certain subscription basis. So this you can, as a powered center, you use the way you want to do it. You can do it whatever you want. Brand center is that we get the e-cessation app and cessation specialist support from ICanCaRe. ICanCaRe will give you the basic support for these patients. And the franchise centers are like we are setting up our own centers, or means typically full branded as ICanCaRe center, and of course with your help and you being the tobacco cessation specialist there. Allied partners, they are the doctors where you will create your own allied partners, the referral doctors who will send patients to you for this particular disease, that is tobacco cessation. So these are the different types of center. Powered center, I have already spoken to you. Subscription to the app is required. The data security is there. Referral fee to the ICanCaRe for online patients. These are different models that is available. The branded center I have already said. The royalty fee. This is the franchisee center, and of course this is the networking system that we have developed. That we have got tobacco marshals in the social groups. The tobacco cessation specialist, that is you, the tobacco ambassadors, and the allied partners who are there in the society who feed your center with patients, right? So now looking at the community programs and how to create a network of doctors and network system. How do you do that? See, the important is मैंने दुकान खोल लिया, दुकान तो खोल लिया, सेंटर भी बना दिया, अब पेशेंट ही नहीं आएंगे, ग्राहक ही नहीं आएगा, तो हम करेंगे क्या, है ना? Am I right?
Yes.
We need patients too, so that is what I said, for our own confidence level and for the confidence of the patient. If the patients are not there, we will lose confidence and we will stop doing tobacco cessation. So, but the confidence level will come only when the patients are coming in and you are doing a successful tobacco cessation for them. Okay? So I'll just show you some like tobacco marshals and other things that we are doing, so that it becomes easy for you to adopt something for your own purpose. So these are the tobacco marshals program. The tobacco marshals are the saviors of the society against the most dreaded disease. That is what we have created. What we are doing, we are asking social people like Innerville Club, Rotary Clubs, any of the social people around you, the teachers, they become tobacco marshals. They are trained, and once they are trained, they can talk intelligently with the people in the society. So once they talk, they can send these patients to you for particular purposes, that is tobacco cessation. So they save the youth. So they have got these 5 main functions that save the youth, that is be smart, do not start, we know what tobacco is easy, be careful and fearful, capacity building in the society, induct more people, and forcing tobacco-free zones in the society. So what we look at is creating from a socially acceptable norm, that is socially acceptable custom, we are making it as a social outrage. That is, the tobacco marshals will not accept any tobacco users around them, right? Similarly, we are also putting it like all the CTCS, everyone should not be accepting tobacco users in their society, right? So not accepting, like that is what I said, when you're looking for a match for your daughter, for yourself, maybe, then you look for a person who is not a tobacco user. So that way a message will start growing that we are not tolerating any of the tobacco users in the society. So focus on tobacco alone would save millions and millions of lives and huge amount of revenue. That is the problem. So these are some of the initial tobacco marshals who were created, and now we have got more than 1,000 tobacco marshals in the society. And we would love to have you as the trainer for the tobacco marshals. Just see who can be your tobacco marshal, and please be part of this tobacco marshal program, which we are having regularly. So these are the tobacco marshals, and this is the way we ask these people to register, and they become the tobacco marshals. So marshals motivate, they create awareness, they recognize tobacco habits on time, sensitize and create surveillance against tobacco, help tobacco addicts to quit the habit, assist in establishing tobacco-free institutions or free societies, lead tobacco control in the society, right? So this is how MARSHAL stands for, right? The tobacco marshals are the most important in the society. So now coming to the community program. Before that, let me ask everyone, what do they think about the tobacco marshals, or will you be able to create your tobacco marshals in the society? Let's ask Dr. Rajkumari.
Yes, sir, but no, we have required the training on how to make the tobacco marshal, no?
Yeah, they need to be trained. See, सबको पता है कि तंबाकू खराब है,
पर उनको ट्रेनिंग
खराब है, कितना बोलना है, कैसे बोलना है, क्या करना है, वो ट्रेनिंग हमारा पूरा सिस्टम है. We have got a training. It's a 4 hours of training program. 4 to 6 hours हो जाता है. and online we are doing it 2 days. ठीक है ना, एक 1 day gap के साथ में we do it on 2 days. So just you have to identify who are likely to be your tobacco marshals.
But sir, to make the awareness in the society, if I are going for a club or something, to make them for the tobacco marshal, that initiation program, what is there? To
Correct.
make them aware about the tobacco marshal. That there
Yes.
is a
So
program.
that is the first program is to be the sensitization program.
Yes.
You sensitize. What we do is we go to the schools, we go to the community, we talk to the clubs. So what we do is we sensitize them, right?
How? By doing what?
By doing a presentation where we have got 6 points of presentation. And one is that be smart, do not start. Number 2 is we know tobacco is easy. Number 3 is be careful and fearful. Number 4 is chota dana. Number 5 is tobacco marshal. Number 6 is basically creating visibility.
Can we share that, sir, slides?
Yes. The next program that we will have, I will invite all of you. I will put in the leaders group. Please do join, because next program we are going to have shortly with the Innerville group on sensitizing them to become tobacco marshals.
Yes, that program will be, so we can go in the outside in periphery, like in government offices also we can go and make them aware to make the society tobacco free like this.
So we have a presentation. We have got a PPT on that.
Yeah.
And we will finalize that PPT, and I think Shruti can share that PPT with you all, so that you all can go to your respected society and you can do a presentation so that more and more people can join into as a tobacco marshal.
Yes. Those who are volunteering.
This is the sensitization program. The sensitization program is done for the schools, for the colleges, for the clubs. So there is a standard sensitization program with a few here and there you can change, and then you can do a prepared presentation.
And sir, this musket we can put in our clinics also. That's no problem.
Of course, this is your mascot now.
Yeah. That's one, but legally it is required. No?
Yes. Please. Now you are ICanCaRe family, right? We extend whatever we have made to you so that you can take it into the society. You have to make your society tobacco free, right? I cannot reach Indore, but you are there in Indore, right? Does it make sense to all? There will be 2 groups of people, one who will learn and practice, the other who will learn and assimilate into their practice.
Yes.
In the sense, they will not set up a center separately, but they do refer these patients, community engagements like doing pledges, awareness programs in schools, colleges, workplaces. Now we have started doing digital programs, organizing road shows, street plays, campaigns, rally, walk, expert health camps, workshops, roundtable discussions, conferences. You see, getting all the types of people into the program. That is like in the camps and roundtable discussions and conferences. We have started an oral oncology connect program. So where we are having trying to now make it at the all India level, so that we have more and more people joining this oral oncology connect program. And every year in the month of April, we have got a oral oncology connect a conference, oral e-conclave, right? So these are some of the glimpses of the program that we have done. This was the program that we had done in 2008. And this was the first such program that was done in India for such. Then these are the school programs where we have got a lot of people talking to us. Again, this was somewhere in 2009. This was again in 2009 where we did in a church. This was the walk with another group. Then this was again, it is in the Noida. We have done this program. I can walk. Right. Then these are the corporate programs like NTPC, B.Ed, colleges, Chhattisgarh, Raipur, Khatima. So many places we have done. And total number of doctors trained is now much more. It is almost like 722 doctors we have trained by now. So various places we are doing an oral oncology connect program. We are doing as basically for talking to the doctors, sensitizing the doctors, and then when we do enroll them in the CTCS courses. So this is a pledge to refrain. This was one of the pledge that was taken with the young girls who are being recruited in the police. So these are some of the systems. Then of course this is the ICanCaRe ecosystem for patient support. We have everything complete: institutional tobacco session, teleconsultation, 24/7 chat, constant motivation, withdrawal management, social engagement, quit buddy support, e-Cessation app. So we have made everything 360-degree program that is there to make sure that this are successful. So we have got vlogs that are YouTube. We have got Quora is there. Then we have got the blog. I'm sure just recently almost everyone of you have retweeted, and we have also shared the blog that I shared recently on the. So these, please, I would request every one of you to subscribe to our site and just forward it so that you can reach out to your lot of people. Just put in your words, something that you want, and then we can reach out. So this is the community. I'm sure all of you are already part of the community, Facebook community.
Yes, sir.
Yeah. So this, we keep on adding a lot of articles, if you have some program done, please feel free to put it there so that there is a visibility. A lot of people will join there. Then you can tag some of your people across in your city so that they will also know that yes, such a program is being done.